Welcome to this updated video for the Pharmacy valproate portal, a user guide for pharmacy clinical staff. This update incorporates the dispensing guidance from September 2023. In this presentation, I will go through who should be screened using the PTL and how you can access the PTL. If this gets a little confusing, please ask a member of the pharmacy governance teams to go through with you. If this is the first time you are watching this video, then let me explain why this is so important for your patients, and why every pharmacist and pharmacy technician should be aware of the dangers of valproate products to the unborn child. The dangers of valproate and its derivatives in pregnancy are well known, with 1 in 10 children exposed to during pregnancy having birth defects. Even worse, 3 to 4 out of every 10 children will have developmental disorders, including significant disabilities. Therefore, the decision to use valproate during pregnancy is weighed up against these risks. To provide assurance that these risks are being managed, all women of childbearing potential, that is from puberty to around the age of 55, must be signed up to the pregnancy prevention program. If you are not familiar with this is completed by the consultant initially prescribing the medicine. All patients must also undergo an annual pregnancy prevention risk assessment. Again, this is conducted by and the responsibility of the consultant specialist. However, as pharmacy, we have a responsibility to ensure this annual assessment has been undertaken prior to every dispensing of a valproate product in a suitable patient. I will go through this later, but let's now discuss the specialist prescriber's responsibility in more detail. The specialist prescriber has full responsibilities for undertaking the initial and subsequent annual risk assessments and can delegate ongoing monitoring to the general practitioner. In fact, the MHRA has now stipulated that 2 specialists must independently consider the risks of pregnancy in those at risk before initiation. The specialists in the East Kent Trust are neurologists and paediatricians. However, as acute hospitals, we will see patients from other areas. The picture to the right shows you the pregnancy prevention risk assessment that is completed by the specialist. So, what are the specific responsibilities of the pharmacy team? These are broken down into 4 parts. Firstly, we have a screening role to ensure that all patients who are admitted into the trust using valproate products are screened against the valproate pharmacy PTL tool. Next, we check and acknowledge that patients have received the annual pregnancy risk assessment. Thirdly, we should remind patients of the dangers in pregnancy and that appropriate contraceptive measures are to be used. This may not be possible depending upon the situation, and professional discretion is needed here. Lastly, the pharmacy must only provide original packs of valproate products. There will be no packing down of medicines unless for very specific reasons such as compliance aids. The screening by pharmacy staff will identify patients who require referral to the specialist using the valproate pharmacy screening PTL. Valproate patient information leaflets, small patient cards, as well as information for healthcare professionals are available to be given out if needed. The screening tool is located in the information portal. Simply search for valproate. Clicking on the valproate icon will open 3 folders. The valproate patient list contains all those registered and is an excellent resource to find patients. The app we will use is the valproate pharmacy screening icon. So let's recap who should be screened using the valproate PTL. Eligible patients are those using any valproate containing products under the age of 55 years. The MHRA has stated that both sexes are affected by this recommendation. However, the PTL is currently for recording valproate use in biological females. So who should we be screening and entering into the PTL? All biological females of childbearing potential must be screened, aged between 13 and 55 years. We do not need to screen those with hysterectomy or where pregnancy is impossible. However, it is good practice to check the PTL to see if the patient is still listed to prompt review if there has been a change in circumstances. The advice in men has been that valproate-containing products may lead to low sperm count and fertility issues. However, a recent study submitted to the MHRA has shown that there may be an increased risk of neurodevelopmental disorders in children of men who took valproate in the 3 months before conception. Although we do not record the screening of men using valproate products, it should be discussed with men the use of contraceptives to prevent pregnancies whilst taking valproate. This is an overview of the process of screening biological females. Once you have identified an eligible patient, simply open up the valproate pharmacy screening app and click the Add button. I will go through each step in more detail, but for now we will consider what to do if a patient is already on the known list. Confirm whether the annual pregnancy prevention review has been completed and that highly effective contraception is being used. Provide an information leaflet and card if patient requires one. If all the questions are answered as yes, then save and exit from the program. If any of the answers are no, then proceed to informing the specialist as will be shown in the next slide. If the patient is not on the PTL, then enter the patient details as fully as possible. It is a good practice at this point to come out of the program and into the valproate patient list to see if the patient is known under another name. All new patients, those who are not using adequate contraception or are in need of an annual review, must be referred to the specialist using the PTL. Before you create the PTL screening, please enter your name and any relevant details. The screening has now been completed and you can exit from the program. With the Sunrise system, it is not possible to ascertain whether effective contraception is being used or if the annual review has taken place. Dispensary-based screening, therefore, has limitations and will require investigation from ward teams if needed. The bottom line is that we should not be delaying or holding any medication, waiting answers to our questions. These can be completed retrospectively. This slide shows the screening PTL without any patients entered. In the live system, prior patients who have been screened will be propagated below. It is only necessary to screen a patient once per admission. Remember, the purpose is to ensure an annual assessment has been undertaken. With the new Sunrise system, there is a prompt to check the PTL when valproate-containing products are being reviewed. For areas where a paper system is still being used and for all outpatient prescriptions, please annotate on the prescription to state a PTL screen has been undertaken. Click the Add button to create new pharmacy screening record. Searching for patients is very easy and should be undertaken in the grey box as shown here. Complete all information on both tabs stating whether patient has undertaken the annual risk assessment and using highly effective contraception. Scroll down the questions answering all that can be completed. If there is a need to refer to the specialist, then enter their name in the grey box. For adults, this is Dr. Moran, Dr. Siddiqui, and Dr. Stanek. For pediatrics, this is Dr. Ahmed Bhatti. Complete the task by clicking Create button. Since we have launched the PTL, there has been several questions asked. The first is, should screening be undertaken if uncertain if patient has gone through the menopause? The MHRA require all biological females aged 55 or below to be screened. If you are unsure, it is best to screen. The second question is whether screening should be undertaken for those who have gone through gender reassignment. The policy refers to the dangers in pregnancy, so biological females who are still able to conceive should be screened, even though they may now identify as a male. Conversely, males who have fully transitioned into a female do not need to be screened as there is no biology that enables pregnancy in that person. The issue of biological male infertility with valproate may be a problem, and it is advised that they seek specialist advice if appropriate. One of the most common questions that is asked in hospital is in relation to biological females with learning difficulties. As healthcare professionals, we should not be judgmental and recognize that those with learning difficulties can have sexual relationships and therefore should be screened. We do need to use discretion, and in many patients with learning difficulties, the caregiver and specialist may deem that the pregnancy prevention program is not applicable and screening is not needed. Please state this in the PTL to avoid inadvertently asking embarrassing questions to vulnerable adults. The final question is whether screening can be completed if all the answers to the questions are not met. This can be difficult, especially if screening in the dispensary and limited ability to ask questions. In this case, it is better to complete what is known and submit the screening request. In summary, it is the responsibility of the pharmacy department to ask all eligible patients about their annual pregnancy risk assessment and to document that this has been undertaken on the valproate screening PTL. But please recognize that valproate medicines are critical medicines and must not be delayed. For further information, please speak to a member of the Clinical Governance Pharmacy team or Medicines Information. Thank you for listening.